Forgiveness therapy for psychological trauma. Summary. The process of addressing and overcoming trauma is a complex journey that entails time and effort-consuming therapy and healing. In a research paper presented by Elliott, the author appeals to the phenomenon of forgiveness as one of the most significant spiritual and psychological practices able to liberate people from mental and, subsequently, physical health complications. The underlying hypothesis of the research paper in question concerns the fact that psychological trauma that derives from early adverse experiences is related and can be combated through its recognition, acknowledgment, and letting go through forgiveness. The first part of the paper tackles the notion of psychological trauma prerequisites that later result in chronic disease emergence. Thus, according to Elliott, the early adverse experiences include ones experienced directly by an individual, encompassing sexual, physical, and psychological abuse, and the implicit experiences that stem from a household where violence and mental disorders are recognized. Later, the author appeals to the fact of how the aforementioned experiences may result in mental and physical complications, and how timely intervention may prevent such dramatic outcomes. Thus, the concept of forgiveness in psychological practice concerns two major stages: elimination of the unforgiveness, or negative thoughts and emotions related to the adverse experience, and the increase in positive reactions and emotive responses. In the psychological practice implications, the author emphasizes the relevance of a process-based therapy approach to forgiveness to eliminate trauma and decrease the risks of chronic disease emergence. Finally, Elliott dwells on the positive physiological implications of forgiveness therapy, including lower heart rate, increased rate of cardiovascular recovery, reduced resting blood pressure, and less EMG tension. Hence, having analyzed scholarly evidence on the practical implications of forgiveness therapy, Elliott concludes that such a psychological intervention is prone to become an invaluable tool in preventing severe mental conditions. Consequently, such risk reduction leads to the prevention of chronic health complications that stem from trauma. Interaction. Although the notion of forgiveness is often associated with therapy and letting go of trauma, I have always struggled with understanding how counselors may adopt forgiveness. The author of the article in question has managed to conduct a profound critical analysis of how forgiveness is perceived both by therapists and individuals. Indeed, one of the major insights presented in the study concerns the differentiation between decisional and emotional forgiveness, as people frequently tend to confuse these notions. While decisional forgiveness is attributed to a purely cognitive and functional process of forgiving the abuser without eliminating the emotive constituent, emotional forgiveness encompasses the process of letting go of emotional baggage and providing oneself with the opportunity to heal. Thus, in order to define how one can make sure that the process of forgiveness takes place on the level of emotions, I referred to the process-defined forgiveness model by Enright, as it was mentioned in the initial study. In the research process, I discovered a more contemporary and holistic approach to forgiveness known as the REACH model. Such a holistic approach resonates with the aspect of spirituality addressed by Elliott, as the ability to forgive and manifest mercy is central to the conventional Christian tradition of finding peace and living in the image of God, capable of forgiving human sins. Hence, while analyzing this article, I have concluded that the holistic and meaningful approach to mental health is key in securing efficient patterns of addressing well-being and public health, outlining the need to promote spiritual and mental healing on a regular and accessible basis. Application. An example of forgiveness therapy may be a clinical patient with a binge eating disorder, BED, who experienced consistent emotional and physical abuse from her parents in early childhood and adolescence. According to Elliott, the first step toward rehabilitation would be the elimination of unforgiveness. In terms of the REACH model, the forgiveness journey will start with the painful process of recalling the pain. Thus, it will be necessary for me to trigger the patient's memories of adverse experiences in order for them to link them to the reasons behind compulsive eating as an escape mechanism. The next step will be to encourage the feeling of empathy toward the offender. It may be achieved through the in-depth discussion of the precedents that might have provoked abusive behavior in the offender in the first place. Then, it will be imperative to present the act of forgiveness as an altruistic gift for the offender, emotionally commit to the decision to forgive, and move on from the pain and emotional distress. From this point, a person is to experience the implications of the second forgiveness step outlined by Elliott, which concerns an increase in positive emotions and ease related to letting go and forgiveness. Once experiencing this feeling, the patient will be more likely to apply for forgiveness at times of hardship.